children and families. So welcome everybody, and I'm going to ask the clerk, if she must be on, to do the roll call for us.
Okay. Chairwoman Julie Casimiro.
Here.
Whip Chippendale.
Present.
Representative Filella.
Here.
Representative Messier. Representative Norray.
Here.
Okay. Thank you.
And okay. Everybody's here. We have a quorum. I want to thank Acting Director Aucoin for reaching out to me so promptly about this meeting. I really appreciate it. Director Aucoin asked me if it was okay for him to give an update on what's happening at DCYF. And there were basically 4 areas that he wanted to cover: a reduction in the number of children in and out of home care, an increase in your utilization of kinship families, an increase in the number of licensed non-kinship foster homes, and a decrease in the number of children placed in congregate care facilities. So I'm going to basically just turn this over to Director Aucoin, and I think his presentation is going to be about 20 minutes, and then we'll just do a Q&A right after that. So, Director, it's all yours.
Thank you, Chairwoman, and members of the committee. Thank you for engaging us in this discussion. It is it is wonderful to be able to have this discussion at 10 in the morning. So certainly this is one of the benefits of Zoom, being able to bring everyone together at any time and engage in a really important public policy discussion. Really, we're looking forward today, and I'm really going to try to keep it at 20 minutes. I tend to talk too much, but we really want to focus on, give us an opportunity to update you on some of the practice changes that we've made here at DCYF over the last 18 months. And at the same time, reflect on how those practice changes continue to reflect on our core goals of promoting family and child well-being. I've asked Adam Williams, who's our legislative liaison, to assist me in this presentation. So Adam's going to be sharing the screen, and we'll walk through the presentation that we sent to you yesterday. Adam, could you put the screen up? And go to the first slide. Thank you. The next slide. So over the last 18 months, we started back in the fall of 2019, and we put together what we called a back to basics strategy. And the back to basics strategy really focused on the core elements of child welfare practice, both in Rhode Island, regionally, and nationally. It starts with prevention. That is the cornerstone of back to basic practice in child welfare services. The next, we were focusing on child protective services, both our screening and response to abuse and neglect reports. Next, we were looking at, if a child had to come into care, promoting more family-based placements, particularly relying on kin. And if we could not place a child with a relative or a kin, promoting and increasing our availability to place children with traditional families. We also focused on permanency, timely permanency, and the goal there being engaging families to promote safe and effective reunification, if possible, within a timely manner. During the course of the last 18 months, the next little segment there, we talked about implementation of a family engagement practice model. So our cornerstone were those 4 elements that I talked about. The implementation of a practice family model, engagement family model, starts with our child protective division and then goes into our family service division. And as we talk about it this morning in the upcoming slides, you'll get a sense of how that really has impacted on the cornerstone, on the foundation of our child welfare practice, and how it's moved us closer to achieving and promoting child and family well-being. Next slide, Adam. So for this presentation, we've developed a house. Our Chief of Staff, Amy Mitchell, our senior leadership, we've created a house, and we had the house created back in the fall of 2019. We modified the house for this presentation to fit within the core elements of what we asked to address today. But I can tell you that the actual foundation of the house remains the same, and you'll see that laid out at the top. Our goals are about effectuating a prevention plan, an effective prevention plan, an effective prevention strategy. It talks about promoting family engagement. And again, you'll hear about that in the context of child protective services and family services. And it also reflects if child needs to come into care, our efforts to place children with family, whether it's relatives, kin, or traditional foster families. We also are focused on promoting youth development, both in our juvenile justice program, also for youth aging out of care. And lastly, we've added to the house an important element of our foundation. Okay, that is applying a race and ethnic lens to everything we do. In all the elements and all the practice shifts that we implement, we have embedded race equity across the department, and we'll talk a little about that toward the end. Next slide, Adam. So I want to walk you through some of the shifts in practice. Some of it reflects ongoing practice. Some of it reflects enhancing what had already begun previously, because we did begin this under the guise of pivot to prevention. I'd say we moved beyond pivot to prevention to now into a prevention mindset. So you can see that the focus here is prevention and diversion. This becomes very critical to the functioning of DCYF in Rhode Island and also other child welfare agencies nationally and regionally because of a federal law that was passed by Congress in 2018. It's called the Family First Prevention Act. And it's a new way, and the Children's Bureau, through this act, provides a new way of funding to state agencies and providing what we call 4E funding to promote prevention services. So it's certainly a new way of doing business, and it certainly encourages and incentivizes states to be able to provide families with support services before they come to our front door. And our front door in this case is CPS. In Rhode Island, we built off the infrastructure that had been in place in Rhode Island since about 2007, 2008. We have a network of organizations, private providers in the community that we refer to as family care community partners. We started with 4 back in 2008, and today we're at 5 community partners that make up this FCCP network. They provide wraparound case management services to families who are reaching out and asking for support. Everything is voluntary. It is done outside of DCYF. So they're engaging with families before there is any documented, in most cases, any documented evidence of maltreatment. They also engage with families where there is documented maltreatment, but the support services can help remediate those issues that led to the family coming to the department's attention. In addition to the family care community partnerships, as part of our efforts to move forward with prevention, we developed and actually brought online a screening and response unit. Previously, we had, and that was in September of 2020. Previously, on a Child Protective Service unit, we had Child Protective Services with the investigative arm of Child Protective Services who would go out and investigate cases of child abuse and neglect, and we still have that investigative arm. And we had an intake unit. We decided to move the intake functionality and create a separate functionality at the front end of our family services unit. It affords parents, it affords families who are at risk of potential maltreatment, okay, to be able to reach out to DCYF, reach out to our community providers, and ask for support without having to go through our Child Protective Service hotline. So we created our own family support line that we opened up, and to date, we started at the week of September 28th, and here we are the second week of March. That unit to date has served 490 families. So it's really a different way of us, it's short-term involvement, different way of us engaging with families. It's non-adversarial, everything's voluntary. We reach out to the family, we assess what's going on, see if they are interested in receiving support. It's not mandatory. If the family declines support, then so be it. But we've found most families have been receptive to discussing the case with our agency caseworkers, and ultimately they're offered if there's a need for it, they're offered the opportunity to receive services primarily through the Family Care Community Partnership model. So that's really been a big change in our practice shift of promoting more family support at the front end and separating that functionality from the child protective functionality, which is still an important part, obviously, of responding to child maltreatment reports. Next slide. Oh, before that, I just want to we talk about prevention. We also need to talk about diversion. And the term diversion really is applying to our juvenile justice system. So this year, we've actually changed the name of what we previously referred to as the Division of Juvenile Corrections. We are now referring to that division as the Division of Youth Development. And we'll talk about that in one of the upcoming slides. But the key is that we have engaged with both the Rhode Island Family Court and the Rhode Island for Communities for Justice in working on diversionary plans for youth who are afforded an opportunity to receive assistance to remediate any, let's say, juvenile justice issue in lieu of going deep into the juvenile justice system. Family Court has been doing it for many years under the leadership of Chief Judge Fort. They've actually expanded their diversionary intake process, and it's proven to be very effective. Through the Rhode Island Communities in Justice organization, they work with the juvenile hearing boards in the city and towns around the state. So we have partnered with the Rhode Island Communities in Justice to work with them in the juvenile hearing boards to help support those efforts of processing lower end cases and providing any services, any support through our family care community partnerships to help support the families. Adam, next. So this is one of the key practice changes. We call it the Safe Practice Model. It stands for Safety Assessment through Family Engagement. This is really one of the cornerstones for how we have shifted practice in both child protective services and family services. As the name suggests, family engagement is a key emphasis of this model. We started this back in November of 2019, rolling it out with support from Casey Family Programs. A consultant came on board, helped us roll out a new standardized functional assessment tool with our staff. And through the support of Casey Family Programs, I'm happy to say we continue to have the engagement from the same consultant that led us to developing the tool and implementing the tool. And that's really helped our staff tremendously. So what does this tool do? Previously, the Child Protective Service would respond to an incident-based report. So if someone reports a child was left alone or a child was allegedly abused, the department would go out and try to determine, was the child left alone? Was the child abused? Make a determination, and then ultimately make a recommendation as to is there assess safety and risk, and make a determination as to whether or not there's a need to legally intervene or refer the family to services. What the Safe Practice model does is we still respond to a report and of child maltreatment, but it requires our investigators to go out and assess what's going on in the family. How is the family functioning? What led to this report coming to the DCYF hotline? And work with the family, and this is where the engagement model comes in. Work with the family, assuming that there is evidence to support why this came, that there was some there was some issue of maltreatment in the home, and there was a valid reason for this to occur, work with the family in establishing a safety plan, and that could include extended family members in mitigating that risk, mitigating the impending danger. And that has been, we've been implementing that since November 2019. What's important there is it began before the pandemic, and that'll be important for later on. And it's really been a major shift in practice. It takes time to implement this with fidelity. That's why we have the consultant, and KC Family Programs has agreed to keep the consultant on board. But that's a real big change in practice in Child Protective. The other piece of the safe practice model is it doesn't just stop with Child Protective. That model also lends over or continues on for any case where we do become involved, our family services units, the child welfare division of the department, where we may have to legally become involved with a family. If a child has to be removed, we have to develop a service plan. Well, under the safe practice model, it provides for an ongoing functional assessment of the family that will help support the development of a service plan. Again, the emphasis being engaging the family in determining what needs to change, what behavioral change that we need to address to make it safe for the child to be able to return home, and with the emphasis being on family engagement. Next slide. So the other element, and this began back in 2019 and really picked up a lot of momentum during 2020, is the initiative that we call right-sizing foster care. And this has a lot of elements to it. Probably the most, the biggest element, the most important element here is it's really an opportunity for the department to increase family engagement. Again, that's that word again. Continue to enhance its efforts to reach out to kinship, reach out to relatives to help support the family. And if a child needs to come into care, seek to place children with kin or with relatives. And if we can't place a child with a kin or a relative due to safety reasons, also seek to increase the availability of what we call traditional family homes so that we have more homes available for children. We developed, the mantra here is very simple. It's really basic. It's every child that comes into care deserves to be placed with a family. They're understanding that there are some children that cannot be placed with a family due to their behavioral health needs. But we want to develop a culture within the agency to promote family first, to promote placement with family if that is appropriate. So that was a key cornerstone to this. And we'll talk about this in terms of where we are today. We set a goal for ourselves in FY21 of recruiting 100 non-traditional, 100 traditional foster homes. That means 100 non-kin, non-relative homes. We worked in partnership with our provider foster care agencies. They were part of this recruitment effort. I'm happy to say this was our goal for FY21. Okay, that means we were seeking to recruit and license 100 additional or new traditional family homes between July 1 of last year and June 30th of this year. I'm really happy to say through the coordinated and collaborative efforts of both the department and the provider agencies, as of today, we've recruited and licensed 125 families. Okay, that's enormous. And that's really a change in terms of our practice and just having the availability of those traditional homes in the event we could not place a child with a relative or kin is really a sea change for us. At the same time, and I think we talked about this in prior oversight hearings, we continued our efforts to not only utilize kinship and relative homes for placement of children coming in care, but also to license those homes. So back in the fall of 2019, we had about 270 licensed kinship homes. And by the spring of 2020, that had increased to over 550 licensed kinship homes. I'm pleased to say today that number has grown, and we continue to sustain that licensing function as we have over 600 licensed kinship homes today. So that has really been an important element of our strategy in moving forward with promoting family and promoting family engagement. The other part of this is that as part of our efforts of developing kin, we've created a kinship support program. So we have kin-to-kin peer mentors to help kin and relatives care for children. We've also have contracts with the Village and Adoption Rhode Island to provide support to kinship care providers who are caring for children. And you'll see when we get to the data why that's important. Because a majority of the children in foster homes today, an overwhelming majority of the children in foster homes today are living with relatives and kin. Next slide, Adam. So as I said, we added to our house the race equity lens. And within the department over the last year, we've created a race equity council. And right now it's an internal group. We are looking to expand that to external participation. They've also worked in coordination with our diversity advisory committee. Actually, Adam Williams is one of the chairs of the diversity advisory committee. And as I said, the focus here is to apply a race equity lens to all of our new practice initiatives. Really, our goal here is to look at the disparity in terms of race and ethnicity of children coming into care, children in placement, children achieving permanency, and we have the data. We need to identify solutions to try to break down that disparity of children by race and ethnicity who are in care and the permanency outcomes for those children. Excuse me for a minute. One of the more recent things that actually Adam was key on this, that Race Equity Advisory Committee did was we looked at our mission statement. We've had a mission statement at DCYF, mission vision statement, since 1994. In fact, it's hanging in my office. I think it certainly matches the department's legal obligations, statutory obligations, and certainly recognize the value of community partnership. However, what we've learned over the last year, and I think both in Rhode Island and elsewhere, what we've learned in the last year is we need to expand the scope of our mission, and we need to bring in the community, and we need to reach out to different groups, race and ethnicity groups, to bring them into the mix. So we came up with a draft of a mission statement that we'll be circulating and seeking comment on. We don't want this to just be a DCYF mission statement. This is a State of Rhode Island Department of Children, Youth, and Families mission statement. So we want both the community, our providers, our partners to be engaged in this process. It's really a powerful moment for us, and we're looking forward to moving forward on that. I just want to quickly, I'm watching my time, strategic dashboard. Now, I know that everyone on this call received about a 40 or 50-page document of all of our strategic dashboard reports. But as Chairwoman Casimiro mentioned at the beginning, I really wanted to address some of the key elements of what we've been seeing to date with regard to numbers. So the first, go to the next slide. The first one is CPS reporting and screening dispositions. And I put this out there because there have been a couple of media reports out there about the impact the pandemic's had in terms of reporting of child abuse and neglect. And we know, and our data reflects it, this only goes back to March of 20, but you'll see those numbers in the box, where the gray box, 47, 32, 40. Those are the average calls per day that we get to the child abuse hotline. If we went back to December, January, February, generally those average calls before the pandemic was 50 to 60 calls a day. So we saw a pretty significant drop, and most of the calls continue during the school year. So there's clear a correlation between children going to school and reports to the hotline. So we saw a pretty significant drop in the calls to the hotline. You're seeing that it's starting to increase, but it's not going back to where it was prior to the pandemic. During the pandemic, we have reached out to various school departments. Our Assistant Director of Child Protective Services, Stephanie Terry, has been in communication with school departments in Woonsocket, Providence, Central Falls, Pawtucket. And the idea there is to make sure that the school departments, because of the distant learning modules, to make sure the school departments were aware of the various community support services that are in place to help support children and families that are feeling stressed by the pandemic and feeling stressed by being cooped up in their homes doing the distant learning. So we have done the community engagement, our stakeholder engagement, and by and large, those school departments have certainly responded very well and are certainly aware of the impact distant learning is having on the children and youth, especially as it is prolonged into this calendar year. Next slide. Children in out-of-home care, in-home and out-of-home care. Well, the orange graph reflects the number of children in out-of-home care, and you'll see that going back to March of 2019, okay, we had 2,076 children in out-of-home care. As of March 1 of 2021, that number is now at 1,878. At the start of this week, we get a weekly report. At the start of this week, the number of children in out-of-home care is now at 1,858. So in a moment, you're going to see that, is this related to the pandemic? Clearly, the pandemic has had an impact on cases coming to our front door. But let's go to the next slide, Adam, because this next slide is necessary to understand that slide. We also track on a regular basis our entry and exit rates for children in care. And you'll see that the gray reflects the entries, and the orange and the green reflect discharges from care. And discharges can be including an outright discharge from care, and the green reflects, actually I may have it, the orange reflects supportive reunification, and the green reflect an outright discharge from care. In either event, if you're in the orange or the green, that means the children are going home. That is the ultimate permanency goal that we want to achieve. And you'll see that really since December of 2019, we have consistently doubled, tripled, and sometimes quadrupled the number of children going home compared to the number of entries coming in. So when we go back to the previous slide, you'll note that the reason for the drop in children in out-of-home care is really related to the case management model that our caseworkers are practicing and have been practicing all throughout 2020 into 2021. And I really do want to, this is a moment that it's important for me to recognize, their heroic efforts in 2020. Certainly there's been an unprecedented time in child welfare practice in all ways, shapes of life, but certainly in child welfare practice. And they have continued throughout the pandemic to go out and see children. They've continued to visit parents. They've engaged parents with service plans, and they're making it happen. And as I said, this slide after this, Adam, this is the proof of really the outcome of their hard work is right in this slide. So really hats off to our casework staff, case management staff, as well as our child protective staff, because they certainly have a large part in terms of responding to child abuse and neglect and making the determinations at the front end of whether or not there's a need to remove a child. Last slide, I think. Yep. Oh, no. This slide here is an important one. So I mentioned the right sizing of foster care initiative. You'll notice the slide on the left talks about number of children in foster care. in foster homes. So we have over 1,400 children in foster home placements. Okay, of the 1,400 and actually 42 children in foster home placements, 1,043 of those children are placed with relatives or kin. That's in excess of 70% of all out-of-home foster home placements are with relatives or kin, and you'll see that blue note at the bottom in the blue box. Okay, last year at this time we were at 64%. So really, it's really a testament to the work that our staff are doing, again, both in CPS and FSU, and really emphasizing the need that if we had to remove a child, keeping the child safe with a relative or kin is the preferable practice model. And you'll see how that has actually impacted on that chart on the left in terms of the dark green. That's relative and kinship placement. The light green are the traditional family placements. The line at the top on the black line reflects of all children in care, the percent of children placed in foster homes. Even with the reduction of children in care today, we are still at 82% of all children in out-of-home placement are placed with a family. And just remember the mantra, every child deserves a family. This is, I think, very important. We're going to continue to track this, obviously, but this is very important to the agency's vision and the agency's plan of promoting family and child well-being. At the same time, the chart on the left, reflects our congregate care numbers. You will see that while we have increased the number of and utilization in kinship homes, relative homes, we've increased the number of traditional family homes, there's been a corresponding decrease in terms of children going into congregate care placements. Congregate care placements over the past fiscal year has dropped by 25%. That's significant. And is it related to the COVID? There's clearly a COVID impact here, but it's also related, and I think in large part, that's why these two slides are together, it's in large part created by the increased family capacity, both kin and traditional foster families. The last slide I just wanted to bring to you, and I know I've gone over what I was hoping to accomplish in terms of time frame. Fewer children on juvenile probation at the training school. As I said, we've been working with community partners on diversion, creating juvenile justice diversions. The family court has been working through its intake office on diversion. And part of this is related to COVID because the number of cases going into the family court has been reduced during the pandemic. But it's important that while you see the data here from March of 20, to put into context this data over a extended period of time. If we went back 10 years ago, the number of youth at the training school would have been in excess of 50 youth. Actually, it was in excess of 60, 70 youth, if you include the female youth at the training school. Today, it's at, I looked at the data this morning, it was at 18. If you look at juvenile probation, we have under this chart 200 youth currently on juvenile probation. I think it's 53 youth are in actual placement. Most of the youth on juvenile probation are on home supervision. 10 years ago, we had over 1,000 youth on community supervision. There has been a huge shift, and I don't think it's, the department can't take credit for this. I don't think any single source can take credit for this. I think a lot of this has to go with the different policing models that are in place in the communities. Providence Police, as we know, have implemented a community policing model. That had a dramatic impact on the number of arrests and the number of petitions that they were filing in juvenile cases. That is it's also then corresponding with a dramatic change in terms of the number of youth that are going deep into the juvenile justice system. And I would just end by saying that the better we can do at diverting youth away from going deep into the juvenile justice system, the better off we're going to be, the better outcomes we're going to have for youth. So I firmly support this. We firmly support the efforts at diversion. We will continue to work with our community partners, continue to work with the family court, and with local law enforcement on promoting safe diversionary strategy to ensure that we get the best outcomes for our youth. With that, I'll turn it back over to the chair. I apologize, went over a little bit. There was a lot to present.
That is a lot to present, and thank you, Kevin. You did a great job. What I think I'm going to do is ask the child advocate to maybe follow up, and then we'll go into a Q&A for both of you.
Sure. Thank you, everyone. Good morning. My name is Jennifer Griffiths. I'm the child advocate. I do want to thank the chair for having us. Nice to see you in this format. To all the committee members, and I thank Representative Donovan and Representative Williams, of course, for joining. And I know they've always followed these issues, and I thank you for that. For those, I think the two representatives I've never met individually, Rep. Falella and Rep. Messier, just to let you know, the Child Advocate's Office oversees DCYF. So our staff of 8 is the oversight agency to DCYF and every policy and practice, every child that's open. And we do a variety of reports, and we monitor all placements, the training school, foster homes, the group homes, court intervention, the death review reports, any public policy. I'm happy to speak more with you offline if you're ever interested in learning more. So in response, as you know, I'm not a PowerPoint lady, but I have plenty to say as always. Thank you, Kevin, for that presentation. I do appreciate it. And I do want to acknowledge, I don't think the DCYF line staff gets enough credit. And I always like to say, they are a 24/7 operation, and they've kept it moving this entire year. So I do appreciate that. Certain things I just would like to bring to all of your attention, things that we're working on, things that I think that each of you as representatives or part of this committee would be interested in to know what kind of my big goals and initiatives are right now. First, I will lead with housing. Housing is the biggest, I believe, roadblock that we're all working against, if you will. And I'm really thankful that I have learned through my new relationships with Rhode Island Housing and different housing authorities that, and I've spoken to several of the representatives on this call about this, about the ability to seek federal funding through the Department of Housing and Urban Development, and to learn that, fortunately or unfortunately, I'm going to go with the positive, fortunately, each city and town in Rhode Island has the ability to apply for these funds, federal funds, that will go returned and unused if we don't use them, for 2 different kinds of vouchers. I apologize for the acronyms. This is how it starts. We have the FYI vouchers, the Fostering Youth Independence. Those are for young people who have aged out of the system and need some assistance. More on that in a minute. And then we have the Family Unification Preservation Grants. So that's for a young family who's open to the department, has a court case, and that last barrier they face, calls I receive all day, and I'm sure you do too, my court case would close, I would be done with DCYF, I've done my mental health, I've done my substance abuse, I've made the adjustments I need to, but I can't find somewhere to live. And we all know how hard it is to find an apartment that is, and I don't like to use the word adequate, I'm not interested in that, safe, affordable, and somewhere you'd want to live. All of us would want to live, not just some, okay, let's stick them here. That's not what I'm looking for. So I've been very pleased to say that East Providence, where I am from, they have begun their process of filing for the vouchers. Pawtucket is involved. Lincoln Cumberland is involved. I do have a meeting with Rep. Nuray coming up about West Warwick. Thank you for that. I appreciate it. Senator Palma has really worked, as we all know, tirelessly on any task you ask him, but Middletown and Newport, and I'm interested to talk with anyone else about how we can get these vouchers. Again, free money from our government to use for our young families to give them a stabilized house. This is a 36-month voucher. This is serious. 36 months could change generationally, change your life in generations going forward. And not to disparage what we offer or have offered, but let's give someone a fighting chance to move in, have an address, enroll your child in school, become involved in a local. It's a big deal, 36 months, especially when you're 18. Think about that, what 3 years meant to you then. Now it seems like nothing. So housing vouchers, very, very involved in that. Number 2, as you always know, I like to talk about residential girls treatment. I'll be talking about this until the day I retire, which is hopefully not for a long time, but residential girls treatment. On any given day, a snapshot, about 40 to 50 young women can be out of state in placements. I want to be clear. This is not to disparage the programs which have been utilized in Massachusetts or Vermont. I'm not speaking poorly about them. But if we can do it there, this is not a specialized with a very specific medical condition, which involves, a high-end treatment or high skills. We can do this right in Rhode Island. And frankly, we have many more opportunities for young men than we do for young women. We have the Ocean Tides, we have NAFI programs, and the training school, through the years, has a majority. Today, there are 3 young women at the training school, and that would mean there's 15 young men. But usually our numbers, there's a big disparity between the two. And as you know, no offense to the young men, but the young women are the future mothers of the next generation, and I do not want to see back on the calendar. So again, this is my pitch always and forever. There are, from the last governor's budget, there was funding for 2 programs. I'm unclear and do not know about our new governor and what his priorities are. But I strongly, again, we need a girls' placement here in Rhode Island, preferably out in the woods, preferably your urban areas. I don't want them, in Providence, no offense to anyone, but I want them far away. I want a school. I want clinical work for several reasons. One, why do we have families, and my prior legal services will always come out. I do not want mom and dad or grandma or a 5th grade teacher or next door neighbor schlepping up to Vermont. They don't have that kind of money. I don't have that kind of money. No one can go up on their schedule if it's a Dunkin' Donuts or working, day jobs to say, gee, let me take off the weekend. That is not something we can all do, myself included. They cannot pay for a hotel or in Western Massachusetts. I want the DCYF social worker to be able to breeze on by to Exeter, West Greenwich to meet with their child. I want my office to be able to go there unannounced to say how things are going. But most importantly, when that young lady gets out, I want her to be able to say, I want to go back to clinician Kathy, not some new person. I want to have a continuum of care. And they belong here in Rhode Island. So girls treatment, find me some land. I will go look at it. So there's that. The other thing I would also like to discuss, I do want to acknowledge, there had been a lot of media attention, not always accurate, about the Bradley situation and children who were placed there. I do want to acknowledge that, yes, COVID is not an excuse, but there was some backlog in many programs being unwilling or unable to take new placements on during that time. Most of that has been alleviated. But again, as Kevin indicated, the more young people we can put with a relative, which is always my first, I want them to be with family if possible. That does free up slots, I hate to say, or spaces for young people to be at a congregate care when there is no one or their needs are too high. But I just do want to acknowledge my office, although it was may not portrayed as to what we were doing in the news, we are involved in every child's education case in court every day in email. So I want to make clear, you all know my assistant child advocate, Caitlin Medeiros, she is on it every single day. So this is not something we were unaware of. I think positive I'd like to talk about, which I think the speaker who's not in this call, but I'm glad that we're having these conversations more frequently in a different manner, is that we are receiving from the Consolidation Appropriations Act more chafee money to supplement, not necessarily pay for services. And I say the we because I work very well with Director Aucoin, and I think I would like to say since he has become the acting director in August 2019, I Zoom with him all day, and then we talk every night. So he and I face problems head on, as opposed to joining the conversation at the 11th hour. He keeps me apprised in a way that I have never been. So I thank him for that. But a positive thing is we are receiving a significant portion of money, just, statewide, that we're going to be able to really make some moves. And supplement housing, food insecurity, a huge thing among our young people and families in general. But I don't want some young person who is aged out of care to be short on food. What do I also not want them to do? Not miss out on any educational opportunities at, whether it's the Promise, CCRI, New England Tech, Tony and Guy, wherever it is. I want them to be able to take advantage of every single opportunity they can. And something we're focusing on really heavily is something we probably all got to do in high school, get our license, go to driver's ed training or some auto school if your parents were not able or willing to drive with you. But we're really focused on how can we get each of these young people a license. Again, back to the housing. We want an apartment that is safe, affordable, and right now our goal is always on the bus line. These kids don't come out with a brand new Honda Accord and a license and insurance to go. They need a way to get places. So let's set them up in a way that we have been, to have a license, to know how to drive legally. So that's something Kevin and my office have been working on each Friday afternoon. How do we spend this money? How do we get aggressive about it? And how do we use every single cent they send us to, supplement what we're doing? Other than that, those are just my basic thoughts on what we've been up to. And as always, I'm open to any questions that any of you may have. Thank you.
So Jen, I'm probably going to start with you because I have fewer questions for you than I do for Kevin. Sorry, Kevin. But the housing that you talked about and the vouchers and stuff, how many families do you think you impacted so far? It doesn't have to be exact number, just a rough number.
Well, so far there's 0. 6 months from now, I think I'd like to come back to you and say 25. So the basic math on it is that each city and town can apply for up to 25 of the young people or the young families with children. Like anything, this is a process. So I'm thankful that I found a friend at Rhode Island Housing who was able to help with the template and the paperwork. No one likes to do paperwork. So the idea is you convince the housing authority, they say yes. The contact at Rhode Island Housing will help them send the paperwork to HUD. HUD sends it to DCYF. Kevin signs it. It goes back to the housing authority, and then they apply for the money. So I do know that it's already gone in East Providence, and I believe it's in the works in the Lincoln Cumberland district. So I'm hopeful that I can come back to you in 6 months and say, we've got 10 in East Providence, we have 17 in Lincoln. And I will say, not to the exclusion of Providence, which is where many of our families do come from or want to reside. They had recently gotten 100 vouchers of regular Section 8, and they're trying to distribute those. So it's not as if they said no, but it's almost like, please circle back with us if you will, and we'll approach it then. So I figured we have 36 other municipalities to hit, so we'll go there first and come back. Okay. So no one yet.
Okay, thank you. And you are constantly beating the drum on the residential girls treatment facilities, and I appreciate that. Go, Jen. And there's been a lot of talk about Zambarano Hospital over the last few days. Is there any opportunity to use facilities at Zambarano Hospital for residential girls treatment?
Not being a building contractor and not being just one lady who owns a house, I will say this. Having viewed several years ago the land at Zambarano, which you just don't happen upon, it's really nice up there. Expansive land. There's a very beautiful lake. If you don't know where you're going, you will not find where you're going. So this is a good place to be, and I think it's very nice up there. Problem is, so many of the buildings have been neglected. I know we have a lot of things to address, so I'm not suggesting, but many of these buildings sit vacant. And I think to the point of you don't need to be a contractor to look at it and say, oh, we're not putting anyone in here. These are in serious disrepair. So there's all the buildings up there, many of them are not able to be lived in. What I have viewed are the 3, I guess best to call them brick buildings that had once served the Phoenix House, which had been a residential juvenile drug treatment, I would say, before I became the child advocate. So we're looking, 5 to 10 years ago. I will say when several placements had issues last March, Corona was new, we had quarantine, what do we do? People don't want to come to work, and several placements, unfortunately, had to close immediately. So I was on the phone with Kevin the whole time, so he kept me apprised, and we figured out a plan of who we would send where. So I will say that Administrator Stephanie Terry and I were at Zambarano extensively in the March, hanging curtains, putting together TVs and furniture, skills I did not know I possessed, but we set up a COVID positive situation for families. Some work was done by the DOA. It's not my ideal. I don't think the setup is the format which we would want for the residential girls, but I think there's land there. There's expansive amounts of land. And like I said, it's in the middle of nowhere. That's good. Mm-hmm. That's what I want. So as of right now, Kevin could tell you, I don't know the status of how many families, if any, are up there, but the smaller portion of what we had set, then we have the hospital portion on the other part. But I would say at least half the buildings are vacant. I don't think anyone would live there.
Okay. And my last question for you, Jen, is the chafing money. I'm sure that expires soon. What do you need from the General Assembly to help spend that money or help get that money moving?
Well, I would say this. I think we just received yesterday, and I say we, Kevin got it from the government, sent it right to me in minutes, the actual guidance document on how that can you spend this money. So like I said, you can't, if you're already hurting in one department, you can't throw money at, you have to expand and, new programs. So I think he and we are all meeting again this Friday. I will come back to you and let you know, because I think a really good thing about this is public information. We have the extension of care program, which could always be, further explained to people. If you're 18 to 21, you may return to DCYF for help. But now this money extends to those also reaching 26. So I think getting the word out once we have a plan, and I know my office is working on some one-pagers, what can we do for you with this money to distribute to the courts, to distribute to DCYF, to distribute to anyone. I think this could be something either, however you all communicate with your constituents, social media, Facebook, whatever, to say, listen, do you know of someone? Let them go back to DCYF and get some extra help with food or housing or education, spreading the word. And this is a positive program, positive money coming our way that we can really make a change. So I'd like to, continue to communicate with all of you about the housing vouchers, because that means everything to me and to my office about how we can dramatically change how things go. But this Chafee money, I believe it's 1.7 million. I don't want to misspeak, but Kevin's telling me yes. That's a lot of money for a smaller subset of young people who we can really help out right now. It's a tough time. So thank you, and I will certainly let you know what else, if anything, you can do.
Thank you, Jen. Okay, Kevin, I got a couple for you now. When you talked about the right sizing of foster care, who negotiates the contracts with the private agencies?
DCYF does. So back in the spring and summer of 2020, we set out to negotiate we have 10 provider agencies that provide specialized foster care. So we set out to renegotiate their contracts, and by the end of August, all 10 contracts were renegotiated.
So does that follow the state bidding process?
It modified the existing contracts. So those contracts were previously awarded through the state procurement process.
Okay.
But this was an amendment to an existing contract. It did not need to go back out to re-procurement.
And what type of oversight is given to those contracts? Is it DCYF? Is it Department of Administration? Who makes sure that those private agencies are doing what they're telling you they're going to be doing?
DCYF, Madam Chair, we have a Office of Contract Oversight. It's led by Deb Boffey. We also do quarterly active contract management meetings where we review data. We actually have one coming up on these very contracts. So we do that on a regular basis. We also have oversight because they are managing foster parents. We also have oversight in our licensing division as well.
And I have two more questions, and I can open it up to the rest of the team. But the drop in calls that we're seeing because of COVID and kids not being actually in school, what does that look like for caseloads right now? I'm assuming caseloads have died, but I'm also assuming that you've had attrition. So could you talk about the average caseload right now for your workers?
So caseloads are in two elements. So the first element is Child Protective Services. The second one is Family Services, social workers. So for Child Protective workers, as a result of the decrease in the number of calls coming to the hotline, we have experienced a decrease in the average number of cases being assigned to the investigators. Quite frankly, it has allowed us to maintain a more manageable caseload for the Child Protective investigators. At current, I don't have the chart right in front of me, but at current, on average case, the Child Protective investigators have a caseload of about 11 or 12 investigations each. That is certainly a much better number than having over 20 or more cases assigned to them each. In terms of family services, so that's where the impact of a reduction of calls to the hotline has its most dramatic impact. In terms of social workers, we have seen the casework, the social casework caseloads increase. It had increased to an average of 17.6 families per caseworker was the high. It leveled off. Over the last 18 months, we have done hiring. Even during the pandemic, we were hiring. So overall, we've hired 27 social workers in the last 18 months. I'm pleased to say we had absolutely been able to retain all 27 of those caseworkers. We have another class of caseworkers starting at the end of this month. So we were hoping to bring on 9 caseworkers. To date, we have 8 of the 9. If we can get one more, that'd be great. We have to go off of the civil service list. So we're working our way through the civil service list. But we will have at least 8 caseworkers beginning at the end of March. What we've seen as a result of the hiring and retention of staff is that we have now reduced the average number of caseloads for family services. As of the beginning of March, the average caseload for a family caseworker that has 14 or more families has dropped to 16.6 families, and the average caseload for caseworkers with 10 or more families has dropped to 15.5. The way this works is as we hire staff, they go through an orientation process. They don't get assigned cases early on. In fact, we very gradually begin to assign them cases by the time they're into their 3rd or 4th month of the orientation. So every 3 to 4 months, as we see a new class beginning, and given our retention rates with the training class as of late, we begin to see the decline in the caseloads. In this instance, I would expect that the average caseload for caseworkers with 14 or more families will ultimately come down and will marry up with the caseloads with the social workers with 10 or more families. So it should be somewhere in the 15 range, 15.7, 15.8 range. And then when we bring on these next 8 or 9 caseworkers, you would expect to see a further reduction in caseloads by the time we get to July over the summer. I might add, because there's been some discussion, so thank you for asking this. By hiring the staff, by the end of March, we were only going to have 3 social casework vacancies throughout the agency. We would have filled almost every authorized social casework staff position within DCYF when we bring on this next 8 or 9 social workers. And that's tremendous. We are also bringing on 4 child protective investigators during this same class. So our plan right now is to bring them on, do the orientation, and we would then look to create new opportunities for the hiring of more social caseworkers and investigators sometime in June or July. And at that point, we can assess our vacancy and determine how many we can hire in accord with the budget.
So my last question for you is, in congregate care settings, the numbers are down, and that's great because all kids should be with the family. But there are some kids who shouldn't be with the family because of some of the specialized needs that they have. There's all kinds of rumors going around about Tanner Hill and Devereaux. Could you just talk a little bit about those?
Yeah, we've received notice from Devereaux, so it's really one program. They operate 2 different group homes.
Okay.
We received notice from Devereaux that they are closing their 2 group homes. They gave us a 90-day notice. So we've reached out to Devereaux. We'll be having a planning meeting with Devereaux. We very much would like them to reconsider, at the very least, be able to continue to operate 1 group home. They provide group homes for adolescent boys and also younger boys under the age of 11. Technically, what I'd love to see them do is be able to provide ongoing congregate care group home services for the adolescent boys. And Jennifer and I have talked about this, so this is almost our daily calls. We talked about if the preference, I'd love for them to be able to keep that program, that facility up in Pasco. But we'll talk to them about it. Over the years, we have made, over the last 18 months, we've made over 100 referrals to Devereaux. So we have to try to figure out what is, what's happening in terms of, we understand that the number of children in congregate care is going down, but there continues to be a need for group home settings for adolescent boys. Just as Jennifer said, there's certainly a compelling need for group home settings for adolescent females. So I'm confident that we can work through this with Devereaux. We just had one discussion so far, and Deb Boffey has actually scheduled a follow-up meeting with their CEO and their CFO to see what we can work out.
My concern, I guess, is if we're moving towards a more normal with kids returning to school and a more normal way of life this pandemic, what's going to happen if these places close and we go back to normal and discover all these issues? That's my only concern there. I don't need an answer because no one has a crystal ball in front of them. So I'll just turn it over to the rest of the subcommittee with their questions. Anybody have any questions? Representative Chippendale.
Thank you, Chairman. And thank you, Kevin, for appearing today before House Oversight. Wow, a lot of stuff. So on Tanneral, because we were just talking about Tanneral and Devereux, I'm hearing a lot of the same things, but I'm hearing that referrals are just not being made. I'm hearing that the referrals are just sitting there and not being sent. I don't know if it's just the hectic nature of the times or what the deal is, but there does seem to be something a little funky going on there. I know that the placements there are very specific, very specific needs are addressed in that facility. So will be interesting to hear more, because it sounds like you're saying the state is trying to continue to engage with those facilities, but everything that I've been hearing and seeing is going in the opposite direction. So I got to try to reconcile that. But I do want to shift over to the CPS stuff that we were talking about earlier, and the charts, which not a big fan of charts myself, but we've got, of course, the lawsuit that we are still under the consent agreement on, with Child Protective Services, the Children's Right lawsuit, and specific to CPS. Does somebody have a microphone open? I'm hearing a lot of feedback and it's hard to hear myself. Specific to CPS, we missed all but 3 of the 12 marks we had to hit in the last test. We had several where the results could not be validated from the department. We did not meet the benchmark. We even provided invalid data regarding sibling placement. We did not meet the benchmarks in case management. We did not meet the benchmarks, and we provided invalid data on visitation information. We did not meet the benchmark, and we had invalid data on licensing. We had invalid data on CPS. We missed the benchmark and had invalid data on case planning. We missed the benchmark on maltreatment in care, and we missed the benchmark on foster home array. And as those who've been involved with DCYF and oversight over the years, you know that we have triggered, through that contract with the court and the settlement, a workload study. And I would love to hear, I got so many more questions to ask, but rather than rambling, I would love to hear what the plan is to execute the workload study. Because, and I want to, once again, like a skipping record, point out that while the rest of the child welfare world looks at cases as children, we in Rhode Island take the unique approach of looking at cases as families, and that can be 1 child or that can be 8 children. And regrettably, we've seen the result of what happens when there are multiple children in the same home. So there is a huge distinction to be made there, that our case measurement in Rhode Island is exponential compared to our sister states throughout the nation. So back to the workload study, Kevin, if you could address that.
Sure. Thank you, Representative Chippendale. Couple of things. We are certainly very much aware of the findings to date on the monitoring reports. We have actually created a corrective action plan to address those items. It's also important to know that the reports that we have to date, I believe we have the first 4 monitoring reports, they do reflect data from 2019, 2018, And we will be getting the fifth monitoring report in probably the second part of 2020. We are currently in the sixth reporting period. We continue to track the progression that we're making. We're looking at, and I will get to the workload study. We're looking at the results. We're seeing if the corrective action plans that we have put into place are driving the needle forward in terms of achieving compliance, both in child protective services, in family services, and in resource family division. In terms of the workload study, based on the reports that we received back in November and December, we have begun the process of looking at and coming up with a scope of work for a workload study. The workload study is going to have an opportunity to weight our caseload, weight the cases that are coming in. We are putting the scope of work together. We're trying to determine if this would have to go out to bid or if it could be done through an existing MPA. I've told Jennifer that we'll be reaching out to schedule a meeting to go over the scope of work for the workload study. So our goal is to implement a workload study between now and June. And we'll be following up with Jennifer rather soon on that. In terms of the measure of families and children, my understanding is that the measure is more accurately reflected in family as opposed to children. And that's going to be important in a workload study because in a workload study, you're really measuring, giving weighted scores to the complexity of the case and the type of work that you're doing. And as you saw in the data charts, it is important to see what's happening with our caseload, what's happening with regard to number of children in care, number of children that are open to DCYF at home, because that's going to be an important criteria to apply when we look at a workload study.
Kevin, I have 4 piles of information on my table right now regarding that lawsuit, and that's one of the things I would like to see the larger oversight committee really delve into, because I think we really need to address how much that lawsuit is costing the state, the effectiveness of it, and like I just think that that whole lawsuit needs a whole big deep dive on it. Jen?
Understood.
Yeah, and am I still? Do I still?
Yes, go ahead.
I'm rolling. I'm on a roll. So the workload study is something that I look forward to. The presentation with the slides that you provided us did occur, in a time when we had a once in a century pandemic, right? And that's out of everybody's control. I will say that no one doesn't recognize that the stress that's put on your department and your employees and families and everyone. So thank you for working through that period. I am a little hesitant to look at the past 18 months retrospectively and try to project anything based on those 18 months, because we will never see anything like these past 18 months again, hopefully for another 100 years. So I'm a little hesitant to take anything that may have happened in that period as an indication that something good is on the horizon. But I have a concern also about the legal department. I've been hearing a lot about that, and this was brought to my attention back when we were fighting for FTEs, and it was learned during our budget debate that positions being reduced and arranged. Oh, don't worry about them. They're just in the legal department. And just digging in a little bit more, it appears that about 33% of the legal team at DCYF has been basically kicked out of the AG's office for one reason or the other, and they have absolutely no experience with child protective services, this line of work, or really anything your department does. And quite frankly, from the voluminous emails and phone calls I've gotten from folks, they have quite literally fallen down on the job and are directly responsible for cases sitting on the shelf for far too long, social caseworkers having to get up in court, raising objections to judges because the attorney is just sitting there scribbling notes instead of advocating for the children. There have been instances of DCYF attorneys interacting in an adversarial way with the department and the clients of the department, which is what you would expect from someone from the AG's office because they're prosecutors. It's not something that I expect in DCYF representing children and families. There seems to be, and I don't know this, I don't practice in court, I'm not an attorney, but I had, somebody had sent me something from indicating the chief judge is completely frustrated with DCYF's legal department. Please, can you expand on that? And is 33% of your legal department former Attorney General staff?
I don't know about the 33%, but I can tell you that over the last year, we did hire, I want to say, 5 attorneys altogether. Of the 5, I want to say 3 or 4 did come from the Attorney General's office. We have 10 attorneys on staff, so 33% is probably a valid number. I just had to do the math in my head. We are very aware of the concerns, both internal, DCYF, and also with the court. We did make a shift in bringing one of our experienced attorneys, Diane Layden, from the county offices and brought her up to Providence. Diane, this is, I could speak from experience. This is a unique type of practice. It is not, quote unquote, a prosecutorial practice. It really is a child welfare practice, and it takes, it's not something you can't learn. Certainly, it's something that can be learned over time and through experience. Diane brings the experience in leadership to be able to supervise the attorneys, particularly in the Providence office. And at least the preliminary feedback I'm getting to date is that there has been some improvement in terms of the performance in the legal office. But Representative Chittendale, I would have to agree that those concerns are concerns of mine insofar as my previous experience working in the legal office. I am confident that Diane, having worked with Diane personally over the last 10 years, I'm confident Diane has the experience to get the job done and will continue her efforts in managing the attorneys and managing the cases in the court to the extent we eliminate those concerns that you've heard about.
So Kevin, when did Diane start?
Diane returned, we're in the month of March. Diane returned to the Providence office in February, beginning of February.
So I'm happy to hear that you have someone who will be monitoring this. It is now officially flat on the radar and will be presented to you with facts, figures, and anecdotes every single time you or one of your delegates appear before oversight, because to me, the foundational element of the legal system in child welfare is so important that if we have people falling down incompetent or unable to do the job right now for whatever reason, and I don't mince words clearly, then we have a foundational problem in the entire institution. So that little house diagram on the slideshow is not sitting on a good foundation. It's sitting on dirt, and that dirt is going to turn to mud soon if we don't get that fixed. So we will be monitoring that very close. Certainly, I will be monitoring that. Relative
to answer your question, do you want that on the next agenda for the overall oversight meeting?
I think if I'm going to leave that to your discretion, if you think it's something that should be solely addressed in oversight, or if we could continue it here. It's just, again, of course, the director is doing the best he can under the circumstances. So I do want, I just want to let him know that these are the types of things that will happen. These will come to our attention, and we're going to stay on top of them.
Perfect.
And so I think that will work in this committee. And speaking of staying on top of things, you did, Director, talk about the FTEs, and I can't help but myself ever, but to remind people that back in 2005 we had 875 FTEs, and today we have, I think, because I can't even get a straight answer from anyone, I think we have 617.5, but I could be completely wrong. However, 875 minus 617 is the math equals unacceptable, completely unacceptable. We know, and we allocated $500,000 to your department to get accredited. We know that you did not even pass the flyby accreditation. They looked at you from 50,000 feet and said, first of all, you're 90 people short on your social caseworkers, and second of all, your supervisory staff doesn't have the requisite education. So please don't bother spending your money on trying to seek accreditation right now. You guys you're bringing a T-ball team to Fenway Park, and it ain't gonna fly. So I need to know, what happened to the $500 million? And I hope the answer is we're hiring more social caseworkers, but I know that that's not the way it works. What happened to the 500,000? Where are we in the accreditation process? And that is a question that I will wait for.
Okay, so on the 500,000, we actually, Adam Williams on this call, we put together an internal team to do that evaluation report that you're referring to, Representative Chippendale. And we worked with the COA organization to understand the requirements that the state would be required to achieve to be able to move forward with COA. We put together that report. The 500,000, we did not utilize the 500,000. I believe that money was transferred back to the general funds. We created the report. We had a mandate to present the report to the General Assembly, to the governor's office. We did that. The 90 positions you're referring to, those were identified as positions we would need, not all social workers, but there were a good number of social workers, but they were staff that we would need to be able to ensure that we would be able to achieve full accreditation. So we provided a plan. We made a recommendation as to how to proceed. There are various options in terms of seeking accreditation. You do it over a 1 year, 2 year, 3 or 4 year plan. We put out the cost of what this would mean to Rhode Island if we were to do it. And at this point, the next step on the COA would really be dependent on whether or not there is any appropriation to support the state going forward with an accreditation model. Our recommendation was if the state was going to do it, it would certainly be in the state's interest to do it incrementally over a 4-year period of time.
Well, it certainly would be in the state's interest. It would be in the interest of the children in the state's care as well. The mantra we heard of earlier, that every child deserves a home, is almost right. It's every child deserves a safe home, and we're not able to really do that right now. The numbers again on the caseworkers. We have just given back $500,000 to the general fund, AK slush fund, that we're never going to see again. We will not ever get accredited if we do not start hiring people en masse, and that has to happen immediately. So I mean, I can't sit by while we. And by the way, the General Assembly legislated. It is your statutory obligation to gain accreditation. You didn't ask for that, of course. You inherited it. That happened in 2010, but yet, in their wisdom, the General Assembly did not fund it. However, 2 years ago, 2 budget cycles ago, we did fund it with $500,000 that we just learned went back into the slush fund, which is not making me a happy camper. So I'll deal with that on my side. That's not your issue. Well, I mean, the part that's your issue is your issue, but the funding, proper funding, is something we need to fight for in the legislature. So that is a giant pothole in the road to success for DCYF, and it will remain that way. And I think anyone who works there and anyone who's has experience with the department knows that and will agree with it. I'm going to just address one more thing. I could keep going literally all afternoon, but I'm going to address one more thing that really grinds my gears. And this is data that was collected and validated. It was done a year and a half ago, so this may have changed slightly, but I get really, really roiled when I see someone driving a DOT or a DEM brand new Equinox from their house to their office, and it sits in the damn parking lot all day. And the average, I'm just going to give some numbers now. The average number of vehicles at DOT, 98, or the number of vehicles, not average, the number of vehicles is 98. The number of vehicles at DEM, 148. The number of vehicles at DCYF, 75. The average model year in each of those departments: DOT 2015 cars, DEM 2011 cars, DCYF 2008 cars, 2008. Or we can almost get antique plates on them soon. That'll be a savings. The average mileage on those cars: DOT 41,000 miles, DEM 84,000 miles, DCYF 145,000 miles. I have emails that I could read, but I would be violating confidentiality, of people broken down on the side of highways with transmissions that have blown out of the bottom of a car that just came back from the same mechanic that we send our cars to over and over again. I don't know whose cousin he is, but this guy's getting a lot of work from us. He doesn't seem to fix the cars. And that really boils me, because these people are the people at DCYF are using these vehicles to drive children to appointments, to doctors, to hearings in court, to all sorts of places, and their transmissions are dying on the freeway. It's unconscionable to me that we're allowing this to continue to happen. What are we doing to ensure that we're not stranding children on the side of highways? What are we doing?
So to answer that, the department state fleet now is 8182. Over the last year, we actually leased an additional 20 new vehicles, 20 new Jeeps, and that brought us to 102 vehicles. We have recommended that we consider replacing half of the 8182 vehicles. We'd like to be able to continue and extend the lease with the Jeeps, and also be able to replace 20 additional vehicles. So we certainly recognize the need, as you're articulating it, recognize the need to replace the aging fleet, and would hope that we could do this again incrementally over the next two budget cycles.
Okay. I was just going to wrap it up, Julie. If there's,
and if you didn't cover anything, just email me those topics, and I'll make sure I get them on the list, because I do want to move on. But thank you.
Okay, thank you very much.
Wrap it up.
I yield back to you. Thank you.
Representative Williams, I see you anxiously waving your hand at me, so I'd like to turn it over to Rep. Williams.
Thank you. Good morning, everyone. I have to take some long, soothing breaths before I continue, because Shanae is in the house. She's present. And I have to commend you, Kevin, Adam, and Jennifer, for your presentation. I know I didn't hear from Adam, but I know he's using his little fingers, but I see you. For the presentation, the information that you provided to us this morning. I also want to say, like Representative Chippendale is not fond of, a lot of charts and all that. They're good, I accept them, but I'm not amused by them. That's one. The other thing is, this is feeling to me, and I'm taking some breath, trying not to let Shanae out. This is feeling and sounding like a House Oversight Committee and not a subcommittee. Now, I have no authority on this committee. There's a chair that's very capable and does an excellent job. So in that spirit of it being a subcommittee, I am going to try to be eloquent and as clear as possible with my questions, for which, if at all necessary, when DCYF has to come before the entire House Oversight Committee, then I would present those hard concerns, because there are still many of those that I am looking for answers that I have yet to have gotten. And I don't believe that this subcommittee is the place to do that. So I'm going to do my best to keep it to in its place. So I would like to have an org chart of the department, and that org chart to include the titles, the positions, the dates of which the individuals that's there in the org chart started, if that makes any sense, if there's such a thing. I would like that for the entire department. The other I would like, that is possible, right, Kevin?
It is, Representative Williams. Our org chart right now would be able to provide names, titles. We would have to add the start dates of everybody. And then the question becomes, to what extent do you want to drill down on that? We have the administrative org chart, divisional org chart, and then how far down we want to go in terms of casework is.
Whole shebang, all of it. Thank you.
And I think Representative Chairwoman Williams, I think if Kevin sends that to the clerk, we can get it out to the entire committee and put that on the agenda for the next full committee meeting.
That's fine. That's fine with me. Is there in place right now, and if it isn't, can there be something to be established? And I would be most comfortable it being established, if it's not, in the child advocate's office in her care. And that would be, I'll start it off with a question. Do you, DCYF, have a family or youth, young adult engagement report from that end? I heard about the reports that you presented, Kevin, in regards to what you have done, and you have this team doing this and that and this and the other. So let's turn that around and see if we can, if there is something that the families for which you're servicing or engaged with, if you have anything in play that allows that family or child, young adult, to say, my experience has been wonderful, my experience lacks this. So to hear from them, who are the recipients, the ones who are getting the service. I always hear, the staff is wonderful, and the staff, and look at what we have accomplished. And like Representative Chippendale said, 18 months, honey, I've been having nightmares with regards to some of the children and families during that time. A lot more with the kids not having a solid support. So I would like to know, Kevin, if there's such a system or something to that effect of what I'm asking about, and if it makes sense, because I'm just wanting to hear from the other side. I want to hear from the clients, the family, the recipients. That's important too.
So excellent question, Representative Williams. We are, and Adam is also in the middle of this. As part of our work with the Children's Bureau and our program improvement plan from the last Child and Family Services review, they recommended that we create stakeholder engagement panels and committees. And there are three in particular that we are focused on. One is creating a family advisory committee. Second is recreating, because we've had a youth advisory committee previously, recreating the youth advisory committee. And the third one was creating a foster parent advisory council. The foster parent advisory council is up and running. The update on the family advisory council, we have our assistant director of family services working with Adam to establish a parent advisory council. And then we have a contractor, Communities for People, who's in the process now of recreating the youth advisory council. So those are absolutely spot on recommendations. And there's something that is needed for the department. And these aren't councils that we run. That's the key element here. We want the foster parents, we want the youth, we want the families to run the advisory council. We would be the invited guest to the advisory council and listen to their feedback, get their recommendations, and then respond to those recommendations.
I thank you for that. And I'm glad to hear that there's some action going on in that direction. However, you know, my relationship, not with individuals, that department sucks with a capital SUCK for me. Not personally, I'm not directing it to any particular person, which I can, because they have earned that. But I am concerned I am glad that you have and you're moving in that direction, but I'm concerned that it is in your care. Not you per se, Kevin, but it's in DCYF care. As I mentioned, I'm not sure that Jennifer would be, her department would be able to handle this. No, let me rephrase that. I'm not sure she would want to take that on. I am confident that she could handle it. So just to be able to say that I am comfortable that the participants, not the clients, but the DCYF staff would not be watching and taking care and doing the work and not being objective, because I don't trust it.
Chairwoman Williams, I have a question for you, and maybe for you and Kevin. Would someone from the advisory council come in front of this subcommittee at some point? Maybe a couple of members, or?
Well, certainly the Foster Parent Advisory Council began last month. They had their first meeting. I was chaired by a foster parent. They have a second monthly, they're meeting monthly, then they have subcommittees. So certainly we can ask if anyone from that advisory council wishes to appear, perhaps at a subcommittee meeting. The other two advisory councils, it's hard to say at this point. They'll be having their formation meetings in the next 2 months. And I think once we give them an opportunity to get off the ground, I think that could be a standing request to see if anyone's willing to participate in the meeting of the subcommittee. That'd be fine.
I got to continue, because first and foremost, the advisory council had been formed, put together and all that wonderfulness. Representation, communication plays a big factor in this. Okay? I don't want to see the same old folks that's been in the mix, in that circle, being in the mix here again, because we are going to have the same results that DCYF has been having. I don't care how good things have flipped in the last 18 months. Perception is one thing, reality is another. So how was that formulated? With regards to how was that formulated with regards to who got nominated, who was invited, where did they come from, who are they representing? So who's that makeup? What recommendations? How did that was put together? Okay, so I am applauding that there's something in place, but again, who was the star?
So Representative Williams, actually, I'd like to turn it over to Adam. Adam was working with the capacity building for the Center for the States. They were contracted with the Children's Bureau. They were helping the department formulate and create these advisory groups. And they were actually planning meetings in terms of inviting parents to participate in the planning meetings. There were planning meetings for foster parents. And Adam can talk to where these parents came from, because your point's well taken. We don't want the same folks appearing and participating in the advisory council. We want to expand it. We want a diverse participation in the advisory council. And I participated in those planning meetings, and I thought the parents, these were held at like 7:30 at night for the parents so that they could have time to participate. And I thought it was very well attended. There were people on that call that I had not previously interacted with. So I thought it was a very positive experience. Adam, you just want to speak a little bit to answer Representative Williams' question about where these families came from?
Sure. So with regard to the Foster Family Advisory Council, I believe that starting last summer, we began having open forums with foster parents. So these were calls where foster families from all over the state were coming to hear concerns and also hear about some of the right sizing of foster care initiatives that the director spoke about a bit ago. And in those discussions, those kind of open forums, we actually got feedback from the families around what type of a council that they wanted, right? So we didn't design it ourselves. We actually asked them, what kind of a council would you like to have? And then we designed it around their, how they wanted it to look like. And then we found some champions from those forums who could help kind of lead those sessions. Again, as we said, these are not DCYF led, these are led by families. The first formal meeting of this council was last month, or maybe the beginning of this month. There were 47 parents invited, and Chairwoman Williams, this is an open committee, right? So this is going to evolve over time, and these are going to be this is going to be a committee that is not going to be closed to a certain group of people, right? So if we need more diversity, let's just call it what it is. If we need more Black families, if we need more Latino families, if we need more of whatever type of family at the table, they will be welcome. So this is not something that's going to just happen over 1 month, but this was the first meeting. As I said, there were about 50 parents at the first meeting alone. Similarly, as Kevin mentioned, through the Children's Bureau, we are required to and committed to starting a similar board of biological parents and other caregivers, right? So having a family council that is not a foster family council, but is for families who have been involved with the department currently or previously. And we intend to use the same kind of a model where we reach out to broad groups of people and say, we will help you build a table for you, led by you, to provide us with feedback. And then finally, Chairwoman, the Youth Advisory Board is a board that is already existing. So that board has been established. It's called SPEAK. That is a board that includes youth. That board is going through a change process right now. Right now, it's kind of led by one of our nonprofit partners. We are training those youth in youth development so that they can lead that themselves, and also doing some recruitment to expand that board to include more youth. That's a very, I've met with that board before. It's a very diverse group of youth. As I said, though, it's in the process of being kind of recreated to be a more stronger voice. I think that it's a great idea, Chairwoman, to have, if those leaders are willing, again, these are led by parents and foster parents and youth. If you want to have a direct line of communication to them, I think it's a great idea. Obviously, I can't tell those youth or parents what to do, but I think you hearing from them directly is a great idea. They should have that voice.
I thank you for the information. Based on what you presented, what I am looking for from the department is to express in writing when you are participating with these groups, when you say, you want more diversity and you encourage that is what you say. Again, I am speaking from experience of what is the norm, and the norm based on the conversation and the response tells me that it has not improved. It is going on, but with the same characters, and it may be working for them, and the others are left out, are not being informed, are not being invited, and the decisions that in fact are being discussed and being made are affecting those. So I'll leave that to say, I'm glad to hear that there is something happening. I just would like to see more of inclusiveness of all of those things happening. And then when and if you come before the big oversight committee, that you come and you present and provide the fact that those groups all met and you have a breakdown of 5, 10, and 15, one in each group, and that there's at least representation of every culture and nationality on them from all 39 cities and town, if it's at all possible.
Chairwoman,
so
I think
with that,
Chairwoman, I think you brought up some really valid points that we do need to bring that up in front of the larger oversight committee. I agree.
Oh no, that's why I'm that's why I'm trying to formulate my questions as such, because I know this is a sub and not a committee. So therefore, please a request, bring me what you got. And then if I do my cross-referencing and see that there's a hiccup here, then it's going to be like, why you throw me this monkey wrench because I asked you for a hammer, okay?
Right.
So
Agreed.
At the end of the day, I would like to also know, get the answer, and you can mail all of that stuff to me, everybody, so that we'll be aware. I know you need to be commended with regards to the recruitment of the 125 foster care. I have been speaking to several foster care families that look like me, right, in my city and outside of but another urban community, and they're having hard times. So I want to know, of that 125 that you mentioned, Kevin, how many look like me, and what city or town they're from, and what is the demographic of the children that they are caring for, okay? Also, of the 27 hired caseworkers and the potential 8, 9, and I know that you have to, or you utilize the what do you call it? You go through
civil service list.
Civil service list, which that's another fiasco. How many of those 27 look like me? And how many of those potential 8 or 9 look like me? And please note that there are many on that civil service list that have been on the list, have been removed off the list, and have been ignored on the list that look like me. So I would like to know that answer. And you don't have to answer it now. You can send me that information. Send us that information so that I would have it. And, again, I applaud what you have done, the intent. I am glad to hear that you and Jen have a good working relationship. Now, there ain't no flies on Jen, and I have the utmost confidence in her. And I would stress that I would like to see a discussion amongst you to see if she's willing or whatever, a discussion with regards to that part of those entities that I first brought to light here is in their care and not DCYF care. And that's about what I think I'm gonna bring to this subcommittee, and I look forward to the answers that you will be providing me. And Adam, thank you very much. I want to see that, you're on diversity, but I want to see someone that look like me also working with you. And I know, Adam, you get it. So there's no flies on you either. But I just want to make sure that there is real diversity in the sense that the perspective is from someone who is living it, in it, is of it as well.
Thank you, Chairwoman. Do any of the members of the subcommittee have questions? Representative Norrie?
Thank you, Chairwoman. I would probably say these are more statements. So again, Director, I want to thank you for your presentation today. I do agree with the panel here that you've heard from, that you have made the changes that we've been asking for. I see a lot of positive things coming from your department, from the presentation. So I will say that I think we're moving in the right direction and stepping forward again, as it's been echoed here. I'm happy to see that you've reached your goals or surpassed your goals for 2021 in growing the number of families. Again, as Chairwoman Williams said, more information on that would be great later on. You said something right in the beginning about the Race Equity Council and expanding that to outsiders. That might be something, and again, I'm just going to lob this out there, Chairwoman Williams, that if it's expanded to outsiders, and I think that you would be probably a great person for that committee if it's something that's not a conflict, and because again, you do have such valuable points that you always make. I just, when he said that, I really thought of you first. So. Also, Chairwoman Williams made a great point. I, too, would like to see an org chart showing, exactly how many people are in each department. And again, it's not that I'm concerned with names. I just want to see if we're top heavy as an organization and whether or not we have the right number of people in the right places. And maybe, we could be doing a better job with the potential finances that you have at your hand. And I think that's all for you. Jen Griffith, thank you. As always, I am looking forward to our meeting together and getting this started. As I told you, I have a young lady right now that has been reaching out to me. She's aged out of the system, sharing an apartment with somebody. So again, these vouchers would probably be something that would be perfect for her as well. So again, sooner than later would be excellent to get that meeting together. So, and Chairwoman, thank you. That's all I have to say.
Thank you, Representative Norrie. Does anyone else have anything any other questions or anything they want to add to this?
Just one more with that org chart. Kevin, please put the salaries attached to it. Again, you don't have to put a last name and all that, but I want the dollar figures, darling, please. Kevin,
Adam, Jen, I want to just say thank you. You guys did a great presentation. You gave us a lot of items to bring forward to the overall oversight committee. So I want to say thank you. And I hope that we'll be doing this again sometime in the very near future. So thanks for all the good work, and please keep us posted on anything that we need to be posted on. So thank you very much, everybody. Thank you for your time.
Thank you, everyone.
Thank you.
Thank you, Madam Chair. Thank you.
Thanks. Bye-bye.